Today, once again, this is Dr. and we'll continue with the video lecture on family planning. Right now, we will be discussing on counseling and what are the factors affecting the acceptance and non-acceptance of family planning. This will be followed by the methods of family planning and what are the current trends in family planning. Okay, so we'll start with counseling. So we see here in this picture, we have here a nurse or a midwife counseling a patient, and here we have counseling the couple. So what are our objectives? So by the end of the lecture, you as students will be able to explain how to support informed choice and maintain confidentiality. So discuss natin later what is an informed choice and what is confidentiality. Ito next, this is another challenge for us to discuss sexual health without feeling embarrassed. So, naintindihan ko, you are still young students. Sometimes, nahihiya kayo pag-usapan about sexual health. But later on, once you discuss this more often, mas nagkakaroon tayo ng confidence to discuss these things without feeling embarrassed. So, demonstrate how to help clients discuss and negotiate family planning use with partners. So this is very important. We have to involve the partners in the decision making because it takes two to decide kung anong gusto nilang gamitin. So sometimes ayaw pala ng partner niya yung method na ito. Ito naman ang gusto niya sa partner, ng isang partner niya, ng wife. Then they have to discuss the different methods until such time na meron silang mapag-usapan na mapag-agreehan na method. Next is to identify the belief and attitudes which may interfere with effective counseling. Ano ba yung mga paniniwala nila? Bakit ayaw nila ang ganitong method? Ano ba yung narinig nila about this method? Bakit ayaw nila? Okay, and to describe the 4 stages of family planning counseling and factors that affect the method of choice in family planning. So these things are what we would like to achieve. That for you, these are the things that you have to achieve at the end of this lecture. So, another part of the objective is to demonstrate the use of a counseling tool and the other aids effectively. Demonstrate competence in providing informed choice in family planning counseling and effective communication and counseling skills. So, how do these traditions or beliefs limit a woman's ability to freely choose the use of family planning methods? Meron bang mga naghihinder sa kanya ng mga paniniwala o yung mga sinabi sa kanya ng mga nakakatanda na dapat di niya ito gamitin kasi detrimental to sa health niya? So may mga ganun ba na nangyayari? Okay. So first, i-discuss natin what is an informed choice. As a midwife, nurse, or as a doctor, dapat alam mo kung anong ibig sabihin nito. So, all family planning clients have the right to an informed choice. So, number 1, this is the opportunity to freely choose among the options. Hindi mo pwedeng pilitin or ipagawa kung anong sa tingin mo ang tama para sa kanya. It should be them who will choose this. As a counselor, it is your job to guide them on the advantages and disadvantages of these methods in order for them to be able to choose what is right for them. Pero sila pa rin yan, hindi mo pwedeng ipilit na maglagay ka ng IUD, gumamit ka ng pills, magpa-ligate ka. You cannot do that because it should be a free choice. And kaya siya informed kasi ibig sabihin kailangan alam nila lahat ng detalye about it. It should be complete and accurate detailed information that is easy for them to understand. Yung naiintindihan nila. Siyempre, alam mo naman kung ano yung pasyente mo. Kung halimbawa teenager pa siya, bata pa, or meron siyang problem, ano yung concerns niya, kailangan appropriate yung pag-explain mo sa kanya and dapat alam niya kung anong available options niya. Hindi yung sasabihin mo lang itong option lang na to, pills lang pwede mong gamitin. Eh di yun lang pipiliin niya kasi yun lang sinabi mong available options. Mali in class, it should be all of the information complete and accurate. So an informed choice does not only mean that the patient will choose, but it also means that they are informed about what are the available options or choices. Okay? I hope I made that clear to you. Bawal ang pilitin sila ng gamitin ito. Bawal ang hindi mo sabihin sa kanila lahat ng kanilang options. That is wrong. Okay? So clients have a right to freely choose whether to have children. Ayaw niya pala. Pwede naman pala ang choice nila. Ayaw nila magkaanak. And, or how many to have. So, kung gusto nila na 10 ang anak nila, tignan natin. Kaya ba nila nang maging responsible parents even if that is their choice? Okay. It is also their choice to use family planning or not. Kung in-explain mo na lahat ng possible barriers or concerns na discuss mo na pero still they choose not to use it, then it is still their right to freely choose whether to use it or not. Next is it is also their choice to be tested for sexually transmitted infection or human immunodeficiency virus, meaning you cannot force them to take the test unless sa law natin for epidemiology, if it affects a large population, then they have to do it. Pero kung hindi naman, if it's not a matter of community that is affected, pag individual lang yan, you cannot force them to be tested. They also have the right to choose if they want to use condoms, if they have one or more sexual partners, okay? And to talk with partner about condoms or family planning. So whether they like to talk about it with their partners or not, choice pa rin nila yan. But it is your responsibility as the counselor to explain everything that they need to know. And, of course, class, to reveal their HIV status, confidential ito. Even if you're the doctor and you know the status of the patient, if someone asks you about the HIV status of the patient, halimbawa midwife ka, nabasa mo sa chart, may HIV siya. Nagtanong sa'yo ngayon yung utility worker kasi parang nakikichismis lang siya. Do you have the right to reveal the HIV status of the patient? The answer is no. Okay, they have to have the choice. Pero pag sinabi ng patient, okay lang, sinasabi ko naman dito sa lahat ng pasyente or sa lahat ng tao, then it is their choice also. Next is that you need to learn as midwives, doctors, or nurses is to maintain confidentiality because it is a client's right. Right nila yan. Okay? All sessions that you're going to have with them for family planning, it must be kept confidential. You should not tell anyone except if that is a co-health worker giving health services to the patient. Paano dok pag co-health worker mo, pero parang hindi niya naman ina-attend yung patient na yun. She's not a healthcare worker assisting that patient. Then, you should not still share the records to that of the patient. Halimbawa, yung friend mo, ibang ward naman siya na-assign or ibang area naman siya na-assign, pero gusto niya lang makichismis about sa HIV status ng patient mo. May karapatan ka ba na sabihin? Wala, because you have to maintain confidentiality. This is very important, class. Kapag ikaw ay isang healthcare worker, hindi pwede na chismosa ka. Kasi pwede ka nilang i-kaso. Okay? Assuring clients of confidentiality will help them to feel more relaxed and to share more openly because you will be able to gain trust or rapport. And that is very important. Okay, now, what are the different components of an effective family planning counseling? Number 1 is you have to have a good communication skills. So here, it includes the skills of giving focused information. Okay, halimbawa pinag-uusapan yung family planning. Focused information, sabi niya. Pero ang dami yun nang na-discuss. Ang dami mo nang nakwento sa kanila, kung saan na napunta ang storya nyo. That is not a focused information, rather magulo, di ba? So it should be, when you are communicating about them on family planning, it should be focused on family planning. Pag nag-deviate man, make sure that we go back to the main topic, which is family planning. Next is your ability to guide the client through the counseling process. It does not mean that you will decide for the patient. Hindi mo sasabihin na, ito condom na lang gamitin niyo kasi mura, libre pa dito sa health center. That's wrong. Your role is only to guide them. So, sasabihin mo, ito ang mga advantages at disadvantages ng paggamit ng condom. Ito naman ang advantage at disadvantage ng paggamit ng pills. Ito yung mga pasyente na bawal mag-take ng pills. Those are the things na i-explain natin for them to be guided on what to choose. Okay, next is family planning methods information. So, dito naman class, we're going to discuss now the different methods. So, in the last part of this lecture, in the next lecture videos, i-discuss natin yung mga methods na yan. Now, how do we communicate? So, we have what we call interpersonal communication, which is could be either a nonverbal communication or a verbal communication. So, when we say nonverbal communication, this is still a face-to-face exchange of informations, or information, walang S-class kasi plural na yan. So, exchange of information, ideas, or even feelings, pero it's not through words. Rather, it's through facial expression, gesture, and body positions. Halimbawa, pag sinabi ng patient, alam mo, I really trust you, pero ganito yung tsura niya. Tapos, hindi ka niya pinapakang, hindi ka niya tinitingnan kung saan siya tumitingin. Oh yeah, I'm listening. Tapos nag-detect siya, di ba? Nag-detect siya habang nagsasalita ka. So, that's a non-verbal communication showing kung ano yung nafe-feel ng patient towards you, di ba? So, it's non-verbal communication. When we say verbal communication, you are going to use your voice. Meron kang words na ginagamit to express what you feel. So, there are two ways to communicate to our client, pwedeng verbal and non-verbal. Actually, they go together. So, what are the effective non-verbal communication? Pag ikaw ang counselor ng family planning, you have to pay full attention. Kailangan mo makinig. Hindi yung nagsa-cellphone ka, nagte-text, o kaya kung saan-saan tumitingin, tapos nagsasalita yung patient mo, pero meron kang kinakausap na iba. That's not only ineffective communication, but also it shows disrespect. So, when your patient is talking, you have to listen. Okay? Next, you have to have a relaxed and accepting body posture facing the client. Hindi yung nandyan sa harap mo yung client, pero nakaganyan ka, tapos ganun pa yung kamay mo, which shows not an accepting body posture. Diba? O kaya nag-cellphone ka, hindi ka tumitingin, wala eye contact. So, those are body postures that are not accepting. So, it should be a relaxed and accepting body posture. Okay, facial expression showing interest and acceptance or concern. So, hindi mo kailangan nakasmile ka on the entire process. So, but just that your facial expression should be seen as interested and concerned. Okay? Hindi na kasi mangot, tapos parang halatang-halata na ng kausap mo na ano ba yan, ang tagal naman makipag-usap nito. Parang gano'n yung pinapakita mo. So, mawawala ng gana yung ating patient. So, encouraging gestures like nodding. Okay, pag nag-agree ka sa sinasabi yung mag-agree ka, smile, nag-nod. And then, avoid checking your watch or looking away. Diba, tingin ka lang. So, parang sabi niya na kulang na ata ang time, baka ayaw na akong kausapin. So, that would be the feelings of the patient. So, to help establish a good connection, you have to have an effective non-verbal communication. For verbal communication naman, we give words, diba? So, verbal encouragement. You encourage them, the appropriate tone of voice, hindi parang, diba sinabi ko gumamit kayo ng condom, bakit ayaw nyo makinig, diba? That's so inappropriate. Mataas yung tono mo, o kaya yung parang galit, so that's inappropriate. Okay, paraphrasing what the client says. Kung sinabi natin paraphrasing, may sinabi yung isang pasyente, and then you just repeat what is being said, but using other words, which mean the same thing. So, yun ang ibig sabihin ng paraphrasing. And then, reflecting feelings. So, for example, sabi niya, naku, ma'am, yun nga po yung nakikita ko kasi hindi naman po supportive yung husband ko dito sa paggamit ng family planning method na ito. So, pag sinabi mo reflecting the feelings, sasabihin mo, so nadi-disappoint ka ba or nadi-discourage ka ba dahil sa ganitong pinapakita ng asawa mo? So you're trying to reflect what the patient is feeling, okay? So, yan, active listening is very important talaga. Sabi na nila, we have 2 ears and 1 mouth, which means we have to listen more than to talk more. Okay. So, next, we have paraphrasing and reflecting feelings. What are its purpose? First is, when you paraphrase, you let the client know that you are listening. So, pag, for example, pinarephrase mo yung sinabi niya, sasabihin niya, ay, nakikinig pala sa akin si ma'am o kaya si sir kasi naintindihan niya yung sinabi ko, di ba? Next, it checks that you have understood. When you're paraphrasing and you're reflecting the feelings of the patient, you know, you can only do that if you understood what they said. Okay, so it reflects the client's feelings about the situation and it summarizes or clarifies what the client says. So, they do class to express empathy, not sympathy. Ano may pagkakaiba nila? When you say sympathy, parang awa, di ba? Nagkakaroon ka ng awa sa pasyente, naaawa ka sa kanya. Pero pag sinabi mong empathy, you try to put yourself in her shoes. So, pinisip ko kung ako kaya siya, ano kayang mafe-feel ko? So, if you do that class, you will understand better ano kayang nafe-feel niya rather than naaawa ka sa kanya kaagad, di ba? Mali yun. So, it should be empathy rather than sympathy. So, for example, sabi ng client, my baby wants to feed very often and it makes me feel so tired. Napapagod ako. Gusto niya na naggagatas parati. Napapagod ako. So, as a health worker, sasabihin mo, you are feeling very tired all the time then. So, parang pinaraphrase mo siya, nireflect mo yung feelings niya. So, yun yung sasabihin mo. Hindi yung sasabihin mo na, I know how you feel. My baby also wanted to feed often. I was so exhausted. Alam mo, naintindihan kita kasi ganyan yung pakiramdam ko. Pagod ako. So, this will not help class. You should only paraphrase or reflect the feelings but not share what you feel about it kasi it's not gonna be helpful for the patient as well. Okay? So, next, using simple and clear language. In order to properly communicate, you have to know what your client understands, what dialect or what language your client understands. And dapat gawin mo itong simple na naiintindihan. Kasi if you're going to do that, you make it easier for you and also for your client to understand what you are trying to say. So, clients can easily understand. If clients do not understand, pwede kasi silang magtanong sa'yo, hindi ko naintindihan kasi ano ulit yung sinabi mo. Okay? If they do not understand, they also may not make good decisions or follow yung instructions mo. Magtataka ka na lang, mali yung pinagamit niya ng pills. Yung pala, hindi niya naintindihan yung instruction mo because you did not use simple or clear language. So, what are our other key counseling skills? Yan, ito, very good class. You have to remain non-judgmental and avoid using judging words. Halimbawa, as a midwife, nasa delivery room ka, tapos you're offering the patient the use of an intrauterine device. Tapos sabi niya, naku ma'am, kasi yung isang pinsan ko, nung gumamit ng IUD, pumayat po talaga siya, kaya ayoko pong gamitin. Baka naging judgmental ka na, sabi mo, so, mas pinapaniwalaan mo pa yung kamag-anak mo kaysa sa akin, healthcare worker? Ano ka ba? Bakit ganyan ang pag-iisip mo? O diba, that's already very judgmental. Ang pangit pakinggan class, diba? So, isipin nyo later on, when you become healthcare workers in the hospital, pakinggan nyo yung sarili nyo kung tama pa yung sinasabi nyo. And avoid using judging words, okay? Next, you have to be able to discuss sexual practices and sexuality with comfort. Hindi yung nahihiya ka, parang bastos yung pinag-uusapan nyo because it's not bastos. It is part of sexual health and as healthcare workers, we have to be able to discuss that comfortably. Kasi hindi naman bastos Sabi mo, pasensya na po kayo pero ito po yung pag-uusapan natin. Pero sana hindi nyo po isipin na bastos po ang pinag-uusapan natin, but we are actually discussing po yung health concern po ninyo, specifically sa sexual health. Huwag po kayong mahihiya sa akin, sanay po ako na mapakinggan po ang mga ganitong kwento. So, Ayan. But of course, you have to draw the line. Baka naman ibinabastos ka na ng client mo. So, dapat alam mo din malaman kung saan mo dapat sila i-cut off. Kasi, or pag hindi ka na comfortable dahil medyo bastos na yung approach, then you have to cut it off. Okay? Help clients prepare to talk with their partners about family planning. So, that is also one thing. Hindi lang dapat sila yung nakakaintindi, but they also have to involve their partner. And we have to ask questions effectively. It doesn't mean na dapat lahat tanungin mo sa each mother. Same ang questions mo. It's not. You should always have it personalized such that tatanungin mo lang kung ano yung mga appropriate and effective questions for that mother. So, what are the purpose of asking questions? So, we ask questions because we want to know ano yung mga needs and concerns ng patient natin. And we will be able to involve the client in the conversation and we get to know them more and what are their needs and aspirations. We also help them express their feeling and attitude towards a certain family planning method. So, pag tinatanong mo sila, mas malalaman mo kung ano yung feelings nila towards it. And then we have to show interest and concern. Paulit-ulit natin sinasabi. Dapat, kung magsasalita sila, you have to listen because that's the best way to show interest. And this will also help us to determine ano na ba ang alam ng pasyente on the family planning methods. Okay, and if there are maling information, di ba, fake news na tinatawag natin or myths na kailangan natin i-correct, malalaman natin by asking them the questions. So, halimbawa, later, I will be asking you to perform a role play and in the role play, halimbawa, mayroong misinformation or fake news. Diba? Titignan ko paano niya ko kinorek. Okay? So, there are two types of family planning counseling questions, class. First is, do you wish to have children in the future? Or pwede mo tanungin, how may I help you today? So, dito sa first question natin, sabi niya, how can I help you today? So, this may include questions such as, are you using a family planning method now? Meron ka na bang ginagamit ngayon na family planning method? Worried ka ba na baka buntis ka ngayon? Or pwede mo yung tanungin, gusto mo bang pumili? What's the family planning method that you would like? Or may mga questions ka ba or problems about a certain method? Okay, do you have any concerns about sexually transmitted infection or HIV or AIDS? Or may mga iba ka pa bang kailangan? So these are the things na pwede po natin itanong sa ating patient. Now, negotiating family planning use. Ito, very important kasi ito. Later, on the last part of the discussion, counseling, doon mo na sila tatanungin, di ba? Anong, having discussed everything, ano ang naplano nyong gamitin? So, ang mga tatanungin natin dito, what are some reasons why a woman's partner may give her for not using family planning or why he does not like family planning? So, tatanungin natin yan sa babae, di ba? Bakit ayaw ng partner mo na gamitin ito? Ano yung mga rason niya? Or bakit ayaw ng partner mo mag-family planning? Ano yung mga rason niya? So when we understand the reason, it's easier for us to know, ito pala yung ayaw ng partner niya. So kung ayaw niya ito, baka may mga ibang methods na pwede pala sa gusto ng partner niya. So makaka-negotiate tayo. We will be able to know, ito pala ang gusto niya. Next is, how can you help a client prepare to negotiate family planning use with a partner? So, those are the questions on negotiating. So, pag nalaman mo anong rason ng partner niya, then you will understand how to help a client prepare to negotiate with the partner. Okay? Now, for this lecture, I will be ending it with an individual activity. So, ito, naisip ko that since we are not together and I cannot check on you on how you're going to do it. So I will be asking each student to record a video interview of at least 3 family members or relatives and ask the following questions. So class, make sure that if you're interviewing someone from your household, yung kasama mo sa bahay, mas maganda yun kasi to make sure na hindi ka makikihalubilo sa labas. If you're interviewing a relative na kapitbahay nyo, mag-wear pa rin kayo ng face mask and may social distancing dapat. Okay? So, ang tatanungin natin, ang interviewin natin is isang nanay na kamag-anak din yung nanay o yung may anak na. Tatanungin nyo, ano ba yung mga rason bakit ayaw ng asawa nila ang isang family planning method, for example. So, tatanungin mo muna sila ano ba yung ginagamit nila or gumagamit ba sila ng family planning method. If not, bakit hindi? Anong rason ng babae at anong rason ng asawa niya? And then, tatanungin natin siya, ano ba yung ways for us to help them prepare to negotiate with family planning use. So, kailangan ba na alam nila lahat ng mga choices para matulungan sila, or kailangan ba na kasama dapat yung asawa pag dinidiscuss ang family planning method? Okay? So, this class, you have to submit the recorded video interview in the Facebook Messenger group chat Pathologic OB class within 24 hours after this class. Okay? So, yun lang. We'll see you in the next 2 lectures on family planning. Thank you for listening. Good day, everyone. This is Dr. Nika Taloma, and we are back with the lecture video on family planning. And this is a continuation on the lecture on family planning counseling. So we ended in the last lecture video up on individual activity, and I hope everybody did their part. So to continue with the family planning counseling, it's important for us to understand the beliefs and attitudes of our patient and their partners on the family planning methods. So as a counselor, we have to make sure that we understand or we are aware of the beliefs and attitudes of our patients. And the best way to know that is to interview or to talk to them. So, if you are aware of these beliefs, we can correct kung meron man silang mga fake news na mga napapakinggan or mga hoax news o yung mga mali na news or hindi mga totoo. And what are their attitude? And we have to understand bakit kaya ganun yung attitude niya. Parang, for example, ang ayaw na ayaw nila yun. Bakit kaya ayaw na ayaw nila yung method na yun? So, we have to understand them. So, next, the client may not return if they feel judged or pushed. So, this is what I was talking about earlier. We should not be judgmental. We always have to try to understand our patients. And we have to know that their understanding of family planning is not the same as our understanding. Kasi tayo, nag-aral tayo ng ilang years, o nag-aral tayo ng isang buong kurso at kasama ito sa pinag-aralan natin. Samantalang sila, hindi nila ito alam, kaya dapat hindi mo i-assume na alam nila kung ano yung alam mo. And you should not judge them kapag may mga mali silang alam about the family planning method because nakuha din nila yan sa culture nila or sa mga paniniwala ng matanda sa kanila. Okay? So, you have to remain neutral and non-judgmental. Next is you have to respect the rights of your clients. Sabi nga nila, respect begets respect. Kung nire-respeto mo ang isang tao, makaka-receive ka din ng respeto galing sa kanila. And from here, we have to respect their rights as your clients. This is their rights to choose kung anong family planning method yung gagamitin nila. Hindi ikaw ang magdidictate nun. Hindi mo sila papahiyain kung ayaw nila yung family planning method na ini-insist mo or fino-force mo sa kanila. And of course, last, practicing helps. Kailangan mo i-practice kung paano mag-counsel. Hindi lang yung narinig mo yung lecture ko, tapos kapag gagawin mo, ina-expect mo na perfect mo na ang counseling. So, that is not the case. Most of the time, you need to practice in order for you to better teach your patients kung ano yung gusto mong ituro sa kanila about family planning and what you are supposed to teach them. So there are different stages of family planning counseling. The first one is to establish rapport and assess the client's needs and concerns. Sa lahat ng relationship class, the first thing that you need to establish is rapport. Di ba, nagka-boyfriend ka? Di ba? Sasagutin mo ba siya if you don't trust him? If wala siyang na-establish na rapport or trust, na mapagkakatiwalaan mo siya, hindi ka niya lolokohin, syempre hindi mo siya sasagutin, di ba? Okay, dapat ganun din sa isang relationship mo between the patient and you as the counselor. You have to establish trust. Dapat may pakita mo sa kanya na mapagkakatiwalaan ka niya, that you will protect her privacy or their privacy, and that you are there to support them. That you are reliable. Kasi pag nakita nila yon, they will be able to establish rapport. You will be able to establish rapport. Pangalawa, alamin mo ano ba yung kailangan nila, ano yung concerns nila, so that you will better understand them. Next is to provide information to address the client's needs and concerns. Once na aware ka na kung ano yung ano yung needs and concerns niya, now is the time to provide information. Yung pala nakita mo, ang concern pala, meron pala siyang narinig na fake news. So what you're going to do is to provide the correct information about that family planning method. Next is number 3, you have to help the client to make an informed decision or address a problem. Sabi natin on informed decision, they have the right to choose and they have complete and accurate information about the family planning methods at sila mismo ang pipili. And lastly, you have to help them carry out their decision. Siyempre, naturuan mo na sila, nalaman nyo na kung anong gusto nyong gamitin. Then you have to help them how to carry this out. Turuan mo sila paano gamitin ng tama at i-monitor mo kung nagagawa nga nila ito ng tama. So, what is the counseling tool for family planning? So, we have here, ito na yung tool natin, yung meron siyang different stages. So, when assessing the client's needs and concerns, very common naman ito, you have to greet client appropriately. Good morning po ma'am, ako po si Dr. Taloma, ako po si nurse ganito, ako po si midwife ganito, and ako po ang magiging counselor niyo today. So, sasabihin mo rin na you will be rest assured po that everything na pinag-usapan po natin dito sa ating counseling it will be kept confidential. Wala pong ibang makakaalam nito, kundi ikaw lang po at ako, at kung sino man po ang mga healthcare workers na involved pa po sa bibigay po ng serbisyo sa iyo. So, meron po tayong confidentiality dito at gusto ko po comfortable po kayo na sabi sa akin kung ano po yung mga kailangan nyo. Next, tatanungin natin, ano po yung rason po na nag-visit po kayo ngayon? So, you just let them answer you and then from there, malalaman mo kung anong reason nila, di ba? And then you can probe further. Then, tatanungin mo kung sino ang partner niya or ilan ang partner niya. Pwede natin tanungin yun. Kasi baka pala, yung sa religion nila, pwede ang madaming partner. And then, pero syempre, be careful tayo sa pagtatanong ng ganito kasi baka ma-offend natin sila, lalo na sa ating country, sa mga Pinoy, hindi naman po common sa atin ang may maraming partners, but we have to ask them. And then, ano yung sa life nila, sa bahay, family, health, sexual behavior, and what is their HIV status. Pero sabi nga natin, the status of revealing the option to reveal their HIV status will still be based on the patient's choice. And then, tatanungin na natin, how many children do you plan to have? And what is the desire for family planning? Kung gusto ba nila? And then we also have to ask if they are at risk for sexually transmitted infection, kung meron ba silang maraming sexual partner, gumagamit ba sila ng protection, may symptoms ba sila ng sexually transmitted infection. And pwede natin tanungin, ano po yung ginagawa po ninyo para hindi po natin ma-acquire itong sexually transmitted infection na ito. Okay? So, aside from that, these are the questions that we need to ask the client. Ano po ba ang ideal na family size para sa inyo? So, pwede niyang sabihin, para sa akin, gusto ko isang anak lang. So, yun ang ideal para sa kanya. Sa iba naman, pwede nilang sabihin, gusto ko 5 anak. Sa iba, gusto kong 10 anak. Okay, ano po ba yung home life nila? Ano ba yung situation nila sa bahay sa ngayon? Okay, sino ang partner nila or ilan ang partner nila? You can also ask them, ano po ba ang health status nyo ngayon? May sakit ba si mother? Meron ba siyang comorbidity? Baka pala high blood siya or may diabetes or other na mga sakit. O meron siyang heart problem. So, malalaman natin kung what is the best way to do family planning. And of course, sexual behavior. Baka pala yung client mo, ang trabaho niya is commercial sex worker. So, marami talaga siyang partner. So, makikita natin na important natin malaman kung anong sexual behavior. And of course, we also ask them on their HIV status. Doc, bakit mo pa tatanungin yung HIV status? Kasi class, it will have an effect on the family planning method that they would like to use because it has to give protection, di ba? Physical protection, physical barrier. And of course, isipin natin, Ano magiging effect nito dun sa magiging anak nila, di ba? Okay, next. To provide information to address the client's needs and concern. Halimbawa, wala pa palang method in mind ang patient natin. Wala pa siyang maisip. So, what we can discuss in providing information is, of course, first, that there is a way to protect them from sexually transmitted infection or HIV and AIDS. So, maganda yan. Lalo na pag nakita mo sa question and answer portion yun na meron pala siyang maraming partners. So, we have to discuss that. Pangalawa, you can also discuss your experiences with family planning as a counselor or probably maybe as a mother na nagkaroon din ng mga anak. Ano experience mo? Next, what you have heard about family planning methods. So, pwede rin natin silang tanungin, ano po ba yung mga narinig nyo na po about family planning methods? Ano po yung mga maganda at saka hindi maganda na narinig nyo para maintindihan din natin sila and we can correct the information na mali na naibigay sa kanila. And then, we let them discuss their plan of having children and what is their partners or family's attitudes towards children or the number of children that we will have and what are the other needs and concerns. So kapag na-discuss natin ito lahat and we have given them the information, we can now discuss how you can meet the needs of the client. So iba-iba kasi yung class. There is no one perfect method for each client. Kasi for example, if the client does not want to have a child, edi ang best method sa kanya abstinence. Pero ayaw niyang magkaanak pero gusto niya magkaroon ng sexual activity. So, hindi pwedeng abstinence sa kanya. So, iba-iba. Yung isa naman, ayaw niya magkaanak pero commercial sex worker siya. So, anong best na family planning method sa kanya? So, iba-iba sila. Now, we have to inform the client when needs or concerns are beyond the provider's capability. Kung hindi natin kaya kung ano pala yung plan niya. Okay? And then advice on how to prevent sexually transmitted infection and advice on how to have a healthy pregnancy if the client wants to become pregnant. So next, another thing na kailangan natin i-master as counselors, we have to know what are the benefits of family planning and healthy spacing. So if the client wants family planning, help the client identify methods that are suited for her needs. So, hindi nga lahat pare-pareho ang needs. Therefore, hindi rin pare-pareho ang best methods para sa each of our client. And as a good counselor, that is what you are supposed to know and understand. Ano ba yung best para sa patient mo? So, if the client wants give information on methods of interest. O, halimbawa sabi mo, narinig ko kasi maganda yung IUD kasi ganito yung tita ko. Ito yung ginamit niya. So, interested siya. So, doon pala makikita mo, okay, sige, discuss natin about IUD. Okay? So, next, respond to other client questions or concerns. So, huwag na dapat mapagod sa pagsagot ng mga questions niya. Kasi in answering the questions, you tell them that you are available for them. Na alam mo na may mga pangangailangan sila and that you are willing to help them sa needs na ito. Hindi dapat iniiwan mo siya or sinasabing dami mo namang tanong, nakakapagod. So, hindi maganda yung attitude na ganon. Okay, so we have to ask these 4 questions to identify methods suited for the client's needs and goals. Number 1, do you wish, gusto mo po bang magkaanak in the future? Pangalawa, nagbe-breastfeed ka ba ng infant less than 6 months old ngayon? So, kakapanganak lang pala niya. Number 3, yung partner mo ba supportive sa family planning method? And number 4, are there any methods na you don't want to use or have not tolerated in the past? Now, class, if malam mo lahat ang sagot dito, madadalian ka na ngayon to understand your patient, kung ano yung need niya, and you can better guide them kung ano yung magandang gamitin nila. But as I've mentioned, it's still their choice, okay? What you just need to do is to give them accurate and complete information. So, number 3 is how the client choose methods. Of course, effectiveness. Kung ano effective para sa kanila. Okay, effectiveness. Ang ganda ng pills sa ibang mga babae, effective na effective sa kanila. Pero sa kanya, dahil makakalimutin siya, hindi hindi naging effective sa kanya. So, ano kayang pwede niyang gamitin? Pwede siguro yung depo injections because it will take 3 months bago ulit maging kakailanganin niya ng another na shot. So, ganun yun. We look at the effectiveness. Next is how long the client wants protection from pregnancy. So, gaano ba katagal? Baka gusto niya rin magbuntis after 3 months pala. Bibigyan mo ba siya ng IUD? Ang IUD good for 5 to 10 years. Or kasi pala 17 years old pa lang nung nagbuntis siya ng first baby niya. Ngayon, ayaw niya muna na magbuntis ulit ng gusto niya after 5 or 10 years. So, maganda sa kanya, bigay mo yung IUD kasi matagal yun na gamitin. Okay, ease of use. Ano ba yung madadalian siya na gamitin? Halimbawa, she's a very busy woman, sobrang workaholic, ngayon hindi niya kaya na everyday alalahanin niya na iinom siya ng pills. Then sabihin natin, sige, you can use Depo-Provera. That's an injection given every 3 months only. So baka mas maging madali yun para sa kanya. Okay, so iba-iba talaga class. And then health benefits and possible side effects. So, kung may mga allergy pala sila sa ganito, so isipin natin yung mga side effects na yun. And what are the benefits for them? So, safety, okay, halimbawa yung pills. Meron pala yung patient pala natin, smoker. Alam nyo ba, contraindicated ang pills sa smoker. So, hindi natin dapat yun i-advise sa kanila kasi it's not safe. Okay, help the client make an informed choice. So, you ask them questions about, ask client if she has any questions, kung may tanong pa siya about the methods that you discuss kasi baka hindi pa pala clear sa kanya. And then, you now ask them to choose a method. Anong pipiliin natin, mother? So, use pregnancy checklist or method screening checklist to determine if client can use the method. So, meron tayong checklist for that. And agree on decision or plan in partnership with client. So, pag pumili siya, okay, then we agree. And then we assure them that you are partnering with them or you will be helping them para mag-succeed sila dito. So these are the different methods that they can use. We have here a picture of an IUD, pills, we have the mini pill, long-acting injectable, okay, monthly injectable. We also have implants. Ito yung mga permanent. Vasectomy or female sterilization. Though pwede silang maging reversible, pero low chance of success. Okay? We have condoms, yung barrier method. We also have vaginal methods. May mga cream, foam, mayroong mga diaphragm. Okay, and then we have LAM or lactation amenorrhea method. Pag nagpapasuso, this is a biologic method. And then we have the fertility awareness method or yung tinatawag natin natural family planning method. We just need to know kung kailan ka fertile and that's it. Okay? So next, we have to help carry out client's decision. So give family planning method and condoms if needed. Carry out. Kailangan, may choice na siya eh. So, ang kailangan na lang natin gawin, tulungan sila na gawin ito, i-accomplish or i-implement. So, explain or demonstrate the correct use. So, for example, condom pala ang napili niya. Kailangan as a counselor, whether you're a midwife, nurse, or doctor, you have to know how to teach them how to use it. E paano pag ikaw pala hindi ka rin marunong gumamit? How can you teach the patient? So, hindi ka bastusan class if natutunan mong gamitin ang condom. Because you have to, as a healthcare worker, you have to understand how to use that. Kasi later on, ituturo mo sa kanila. Okay, ask the client to explain or demonstrate, reinforce understanding or correct demonstration. Very important. Para kang teacher. You ask them to show you how to use it. So, explain or demonstrate, reinforce understanding, or correct demonstration. So, remind client what are the possible side effects and reasons to return. Halimbawa, pinagamit mo siya ng pills, ano ba dapat ang titignan niyang symptoms? Kasi pag nagka-headache pala siya o nagsusuka siya, baka mayroon pala siyang kailangan niyang i-stop yun. So, kailangan bumalik siya sa'yo. And then, arrange follow-up, resupply or referral. As tinadyan, resupply. Pills pala ang pinili niya. Pero hindi natin tinitignan, hindi natin minonitor. 2 months na pala siyang walang supply ng pills. Anong nangyari? Di nabuntis siya. Okay, role play or rehearsed negotiation skills. So ito class, I think, pag na-discuss na natin lahat ng mga methods of contraception, I will ask you to choose one method of contraception and then explain to someone in your family kung paano siya gamitin. Okay, mas maganda siguro yun. Para makita ko na tama ang pagkakaintindi nyo sa akin. So, to end this part of our lecture, I will be asking you again for an individual activity. So, kung mapapansin niyo for semifinals, I'm asking you to do individual activities because this will help me and check if you were really able to understand kung ano yung pinag-usapan natin. So, each student will record a video of a role play which demonstrates the 4 stages of family planning counseling session. So, kailangan mo ng isang cameraman yung mag-video sa'yo. And then, syempre, nandun ka, ikaw yung counselor. And you will get a family member who will act as your patient. So, first, you have to establish rapport and assess what are your client's needs and concerns. Makikita nyo naman lahat sa video kanina kung ano yung mga kailangan yung tanungin. And then, number 2, provide information to address the client's needs and concerns. Number 3, help client make an informed decision or address a problem. And then, number 4, help carry out the client's decision. Kailangan makita ko to lahat, okay? Kung best actor or best actress kayo, maganda, pero kailangan complete at maayos. Makikita ko tong content na to. So, submit the recorded video of the role play in the FB Messenger group chat, Pathologic OB class, within 24 hours after this class. Okay? So, class, thank you for listening. This ends my lecture on family planning counseling.